My name is Dr. Michael Hill. I'm a neurosurgeon that practices spine surgery. I'm at the Zavation headquarters. Today we're going to discuss the procedure involved with using the ZVplasty balloon system for bone cement using a Unipedicular approach. These are the different components for the system. This is the jam sheety with a diamond tip. This is a bevel tip. This is a drill. This is the inflation balloon for the system. This is a two-component OsteoFlex cement. This is the bone-filling syringes, and this is the bone filler. We are using the Biomers training model to reproduce a vertebral compression fracture. The important thing is to make sure that your C-arm is set up for adequate AP and lateral, and that you have the model in a prone position. So we're starting with the AP and the lateral views of the spine. This is the AP view. Our first compression deformity that we're going to treat is at T12, which is right here. Now we're going to swing the C-arm to a lateral position to look at the configuration from a lateral approach. As you can see here, this is the T12 compression deformity. We're going to access this vertebral body initially in this training video. So let's look at the anatomy of the vertebral bodies before we begin the procedure. The first thing that we want to identify is on the AP is the pedicle. The pedicle should be at the top third of the vertebral body. In the thoracic spine, the pedicle is usually more oval. And the lumbar spine, the pedicle is usually more round. So as you can see here, you can see both pedicles. The other thing that we want to identify is the midline of the spinous process. You want to have your image as symmetrical as possible, and you want to make sure that the end plates of the bone align on the AP flora. On the lateral view, we want to make sure that we have the pedicles aligned. We want to make sure the end plates are aligned. And we want to be able to identify the foramen. These are the landmarks that you would need to be able to perform this procedure safely. When you begin the procedure, you want to make sure you utilize the lateral for the advancement of your needle as well as the delivery of the cement. That'll provide you the most margin of safety when you're doing this procedure. Typically in the thoracic spine, I'll use either a 10 or a 13 gauge needle, and that depends on the size of the patient, and particularly if the pedicle is small. In the lumbar spine, I will normally use about an 8 gauge because the pedicles tend to be larger. So in the access of doing the procedure, what we want to do is identify the lateral margin of the pedicle. Now normally you would use 1 to 2 finger breaths lateral to the lateral margin of the pedicle. X-ray. Again. Again. So as you can see, the needle is positioned at the lateral margin of the pedicle. So this being the thoracic spine, I would use about 1 finger breath lateral to this to make my incision in the skin to allow me to have the appropriate trajectory down the pedicle. So after we made the incision in the skin, we placed the introducer in, and I'm using a diamond tip jam sheety for this access. And as you can see on the AP, the jam sheety is at the lateral margin of the pedicle, and we will go to a lateral when you can see that position. And as you can see here, the tip of the needle is positioned at the junction of the transverse process pedicle, and the trajectory brings us into the middle of the compression deformity. At this point, we have the jam sheety positioned at the lateral margin of the pedicle. We have entered the pedicle. Our objective is to stay in the safe zone. What we're trying to achieve is to keep the jam sheety needle within the pedicle and not transverse too medially that we wind up in the canal space, not to go too inferior where we can go into the foramen. So we will do a series of AP and lateral x-rays to maintain our trajectory. So this is our first entry point into the pedicle. Now we're going to go to a lateral position and evaluate our trajectory. And as you can see, we've entered into the pedicle. And what we want to do is try to maintain our trajectory down the pedicle. Excellent. And we're entering the pedicle. Now the important part that you see here is that the tip of the needle is near the vertebral body. So we'll go back to an AP. On this view, you can see the needle is approaching the medial aspect of the pedicle, which is keeping us in the safe zone. At this point, we should be at a position to be entering into the vertebral body, and we can evaluate that on the lateral fluoroscopy. And as you can see, we've entered into the vertebral body. We're not too far medially to breach the intercanal space. So the next step in the procedure is to use the hand drill and drill to our target endpoint, which would be in the anterior third of the vertebral body. This is the hand drill that we will use to complete our access into the vertebral body. The inner trocar of the jam sheet is removed, and then we can follow the progression of the drill under fluoroscopy. X-ray. Again. Again. Now that's given us enough access by drilling into the vertebral body to then place the inflation balloon. The Zavation ZVplasty has 3 sizes of balloons, 10, 15, and 20 millimeter lengths. And you can make the decision of which size balloon to use based on the size of the vertebral body of the patient. The next part of the procedure is to place the balloon inside the vertebral body. We take the drill out, and we pass the balloon in through the jam sheet. Now, what's important is there's 2 markers on this balloon that are radio-opaque, one at the tip and one at the back portion. You want to make sure that that's past the end of the jam sheeting needle, because you do not want to inflate this balloon inside of the jam sheeting. There's another black laser marker on the end of the tip, which gives you a guide as to how far in that you are in with the balloon. So as you can see, at this point, the laser line is at the tip. It may be difficult to see from that distance, but more importantly, you can see the 2 radio-opaque beads, one distal and one proximal, that are both past the edge of the jam sheeting needle. We have the inflation system prepared, which has a gauge for pressure reading as we inflate the balloon. We want to keep it in a safe region, which is between 150 to 250 psi. As we start inflating the balloon, we follow the inflation using fluoroscopy. Limit of pressure, and we can see the balloons inflating into the vertebral body. And as you can see, we have a very good void fill with the balloon. Our pressures are not high, they're reading about 120 at this time. I think that's an adequate amount of inflation of the balloon, and our next step should be to deflate the balloon, and then we'll begin mixing the cement. The next step in the procedure is the mixing of the OsteoFlex cement. This has 3 components. There is the cement powder, and there is a metal ball inside. There's the liquid catalyst, and what we want to do is pour the liquid into the container. You place the cap and shake for 15 seconds. You let the ball do the mixing. Now we're filling the transfer syringes with the cement. Each syringe has 2.5 cc's for volume. Once we have the syringes filled, we'll need to wait 3 to 4 minutes for the viscosity to set, and then we can commence with infusing the cement into the vertebral bodies. Now I'm beginning the process of filling the bone fillers. Each bone filler holds 0.9 cc's of cement. At this point, we want to make sure that the cement, after the several minutes of setup time, has a consistency of toothpaste. And as you can see, it's somewhat firm but not completely solid. This makes a good consistency for us to use for the procedure. Now at this point, I'm going to begin the process of filling the vertebral body. We will utilize the lateral x-ray to provide us with guidance in terms of the filling of the cement. Lateral. As you can see, the cement is starting to fill the cavity. And as you can see, there's beginning to be a filling of the vertebral body from the anterior to the posterior aspect. Our task is to try to create a significant amount of bone filling into that void with the cement. Once you've infused the cement into the vertebral body, I normally put the inner trocar, the jam sheety, back in place and wait a couple of minutes for the cement to set. This prevents a tail of cement coming out through the pedicle, or if there's a breach in the pedicle or near the pedicle, it'll prevent extravasation of the cement into places that you do not want it to go. So after a couple of minutes, you let it set, and then you can remove the jam sheety x-ray, and as you can see, there's no tail of cement in the vertebral body pedicle. This concludes the demonstration of doing a unipedicular approach for the ZVplasty system by Zavation.